The upper part of the lungs is called the apex, and the lower part is the base. The left lung has 2 lobes and the right has 3. There is a double-layered membrane on the external surface of the lung that aids in smooth movement of the lungs in the chest cavity. It is important to note that pain fibers are found only in the pleura. None exist in the lung tissue. The respiratory system consists of conducting airways which, successively, are nostrils, trachea, and bronchi and bronchioles. Air is warmed and filtered here. Mucociliary action moves unwanted dust and particles up to the trachea to be swallowed or expectorated. However, excess dust, viruses, smoking, and dry heated air can impair this function. The larynx connects the oropharynx with the trachea and helps to produce speech. The trachea bifurcates at the level of the 5th intercostal space to form the left and right main bronchi. As the bronchioles branch, they become smaller and there is a decrease in cartilage and an increase in smooth muscle tissue. Bronchospasm or contraction of these muscles cause narrowing of the bronchioles, impairing airflow. Soft tissues of the lungs. Lobules are made up of a terminal abronchiole, arteriole, pulmonary capillaries, and a venule. Alveoli are the functional units of the lung and is site of gas exchange. Each alveolus is made up of 2 cell types. Type 1 alveolar cells are thin, squamous epithelial cells where gas exchange takes place. However, they are not capable of cell division on their own. Type 2 alveolar cells are small cuboidal cells that produce surfactant. Pulmonary surfactant decreases surface tension and prevents lungs from sticking together on exhalation. Type 2 cells do not begin to mature until the 26th or 27th week of gestation, which makes maturation of these cells important in premature delivery. They also serve as parent cells for type 1 and 2 alveolar cells and proliferate in the event of lung injury. Nervous system innervation of the lungs. Parasympathetic stimulation causes smooth muscle constriction and narrowing of the airways. This effect is greater in larger airways versus smaller airway. Sympathetic stimulation, on the other hand, causes bronchodilation and glandular secretion inhibition. Movement of the diaphragm is caused by phrenic nerve arising from C3 to C5 injury above the level of C3, causes loss of phrenic nerve innervation and paralysis of breathing function. Ventilation and the mechanics of breathing. When the glottis is open, the pressure in the lungs is equal to the atmospheric pressure. Upon inhalation, the diaphragm and muscles between your ribs contract, creating a negative pressure or vacuum in your chest. Accessory muscles include scalene and sternocleidomastoid muscles, and they assist in this process. Ventilation refers to the movement of air between the atmosphere and the gas exchange portion of the lungs. Lung compliance refers to the ease with which the lungs can be inflated, determined by the elastin and collagen fibers, water content, and surface tension in the lungs. Gas exchange and diffusion. Oxygen and nitrogen are the main gases in the atmosphere. Their combined pressure is referred to as atmospheric pressure. Pressure exerted by a single gas is called partial pressure. Once in the alveoli, exchange of gases across capillaries are conducted through diffusion. Deoxygenated blood in the venules release CO2 into alveolar space and picks up O2 from the same alveolar space. The process of exhalation requires less labor than inhalation. Recoil of the accessory muscles forces air out of the lungs. Lung volumes. The amount of air exchanged during ventilation is composed of tidal volume, which is the volume of air taken in with each breath. Inspiratory reserve volume, which is maximum amount of air that can be taken in on top of the tidal volume, and expiratory reserve volume, which is the maximum amount of air that can be exhaled in excess of tidal volume. Residual volume is the volume of air left in lungs after expiration. Anatomical dead space, 150 to 200 milliliters, is disturbed or moved air in the conducting airways that does not participate in gas exchange. Alveolar dead space, 5 to 10 milliliters, are areas in the alveoli that are ventilated but not perfused. This is often seen in lung disease like a pulmonary embolism. Proper oxygenation requires pulmonary pressures and resistance to be lower in lungs. Movement of blood in lungs requires mean arterial pressure be greater than mean venous pressure. This allows the blood adequate transit time for gas exchange to occur. Additionally, irregular shunting of blood in the pulmonary circulation can lead to a slew of problems. In an anatomic shunt, blood moves from the venous to the arterial side of the circulation without moving through the lungs. While in a physiologic shunt, mismatching of ventilation and perfusion in the lungs results in insufficient ventilation to provide the oxygen needed to oxygenate the blood flowing through the alveolar capillaries. Stark examples of anatomic shunts are patent ductus arteriosus and tetralogy of Fallot seen in children, whereas physiologic shunting is seen as bronchospasm in allergic reactions. Now for a review question. Which of the following is directly responsible for gas exchange? A. Trachea, B. Bronchial circulation, C. Pulmonary circulation, or D. Respiratory membrane?